All right, and Dr. Ewanchyna is going to come up and talk a little bit around some of the quality specific clinical pieces, and then we'll start talking and answering some questions.
So good evening. So I'm a family physician by training, and people went into medicine, and specifically primary care, went into the profession because we really cared deeply for the people that we treat, the people in front of us. And so through today's discussion about some of the quality initiatives that we've been doing, I wanted to highlight some of that deep caring. You already heard about Dr. Cousins talking about the Universal Prenatal Screening Program. And this emanated as well from this deep caring for pregnant women and the children that are going to be born by these pregnant women. And there's also a similar project that is steeped in evidence and quality that I wanted to discuss with you tonight. And it really comes from this deep cause of caring for the public and doing what's right. When we look at clinical medicine, we look at what evidence is there to help support what we're doing. An example that I like to use is we use antibiotics to treat bacterial strep throat infections. But we know that we do not use antibiotics to treat viral sore throat infections. And we do that because there's clear evidence. One of the things that we're now embarking upon, and that we need to do education of the community, education of the public, or our patients, and education of prescribers, the physicians, is the evidence that is very clear now about chronic long-term use of narcotic or opioid prescriptions for pain that is considered non-cancer. Years ago, many physicians thought we were doing the right thing by continuing to prescribe narcotic medications for long-term chronic pain conditions. Now we know the evidence has shown us that even though we thought we were doing the right thing, there's actually more harm associated with long-term prescription opioids for chronic non-cancer pain. And we find that people are actually not functioning as well as we always intended. So the state of Oregon, along with the Center for Disease Control, which is a national body looking at evidence, looking at health outcomes, and our CCO, along with all the other CCOs, are going to be embarking on initiatives to do education about what conditions should have chronic narcotic prescriptions associated with them and which conditions should not. And this is never meant to be a discussion of what is painful, what is not painful, because each of us as human beings have our own pain receptors. And we all view pain differently. And we can never say to a patient that has been receiving pain medications that they don't have pain, that the pain is in their head. That is not true. And that's not what this discussion is about. But it is talking about the risks associated with long-term opioids for pain and what else we can do to try to get people functioning and moving beyond their pain with the other things that currently haven't always been utilized by practicing physicians and by the healthcare system. So we're going to be going through a wonderful transition over the next year in giving more services and more resources to get better pain control without our reliance on long-term opioids. I wanted to share, just in closing, just a few facts for you, and this is not meant to be alarmist, but the facts are legitimate. The facts are there from the Center of Disease Control. The facts are on the Oregon Health Authority website. And the facts are that Oregon has one of the highest rates of prescription opioid misuse in the whole nation. And in Oregon, more deaths occur from opioid prescriptions unintentionally than any other type of drug. And that includes alcohol, methamphetamine, heroin, and cocaine. And an average of 3 Oregonians unfortunately die every week from prescription opioid overdose. Many more develop opioid use disorders, and so there's many partners across the whole state of Oregon that are working together to try to reduce this epidemic. One other statistic I'll share with you is that even though the United States has less than 5% of the whole world's population, We in the United States consume 80% of the world's supply of painkillers. But yet, we do not have 80% more nerve endings in our body in the United States than other citizens on the globe. So there's a lot of work we can do, but we have to do this with compassion. If we reflect on Dr. Cousins' talk again, we cannot revert back to the times of leprosy. We cannot vilify people that have been using pain medications. We have to work with them, look at other appropriate alternatives, and this will be a true partnership. But I'm bringing this up today because of now the evidence and the clinical studies that have pointed us in this direction. So thank you.